Inserting your finger into a rotary pencil sharpener isn't just an accidental injury. It is a catastrophic mechanical trap that locks biological tissue into an unyielding industrial cutter. Within milliseconds, rotating steel blades grab your soft tissue, converting mechanical rotational torque into an unstoppable shearing force against living skin. The secret to this rapid destruction lies in blade geometry. Pencil sharpeners utilize hardened high-carbon steel shaped into a spiral helical cylinder. Engineered with a razor-sharp wedge angle, these blades possess a yield strength exponentially higher than human skin, allowing them to slice through dense wood and biological tissue without dulling. As the crank turns, internal planetary gears multiply your input force. This mechanical advantage focuses dozens of foot-pounds of torque directly onto the narrow cutting edge. Trapped inside the tapering conical chamber, your finger has zero room to expand, turning the sharpener housing into a rigid hydraulic vise. Before the blade even cuts, immense mechanical pressure crushes the fingertip. The specialized fatty pads designed to buffer everyday impacts are compressed flat against your finger bone. Trapped fluid inside the cellular chambers cannot escape, causing localized tissue pressure to skyrocket far beyond structural safety thresholds. As the spiral blade rotates across the compressed skin, it applies extreme lateral shear stress. Human skin resists compression relatively well, but it is highly vulnerable to shear forces. The moment localized shear stress exceeds 2 megapascals, the structural integrity of your outer skin collapses entirely. The blade edge instantly cleaves the stratum corneum, the protective outer shield of keratinized dead cells. Because the steel edge is significantly thinner than an individual cell, it glides through this primary barrier with virtually no mechanical resistance, exposing the delicate living epidermal layers directly beneath it. Deeper inside the dermis, the blade encounters a dense structural matrix of collagen and elastin fibers. Under normal conditions, this matrix gives your skin incredible tensile strength. But against the rotating steel wedge, these fibrous protein cables are stretched to their breaking point and unzipped one by one. Past the dermis, the blade pierces the subcutaneous layer, rupturing thousands of delicate adipocytes. As these microscopic fat cells burst, they release liquid lipids that coat the blade. Far from lubricating the cut, this cellular destruction exposes deeper neurovascular bundles directly to the sharp steel edge. If the finger rotates against the cutter, the blade strikes the hard nail plate. Engineered from tough, fibrous alpha-keratin, the nail plate splits longitudinally along its growth axis. The blade tears the rigid nail away from the underlying nail bed, peeling back one of your body's most sensitive surfaces. The blade's downward plunge finally halts when it strikes the distal phalanx, the hard bone at the tip of your finger. While the steel edge cannot easily slice through dense cortical bone, the immense rotational torque crushes the delicate outer bone layer, grinding directly into the living periosteum. Your fingertips are among the most densely innervated structures on Earth, packed with over 2,000 sensory receptors per square centimeter. Built to perceive microscopic textures and delicate pressure changes, this dense neural architecture transforms tissue destruction into an immediate, overwhelming neurological shockwave of pure agony. The mechanical shearing of nerve fibers violently deforms cell membranes, locking open high-threshold piezo 2-ion channels. A massive surge of sodium and calcium ions floods the severed axons, completely destabilizing their resting electrical potential and triggering an unstoppable barrage of high-frequency biological action potentials. This immediate, sharp pain signal bypasses slow pathways, firing along heavily insulated A-delta nerve fibers. Wrapped in dense myelin sheaths, these high-speed biological cables conduct electrical warning signals up the hand and arm at speeds exceeding 100 feet per second toward the spinal cord. Surging through the median nerve trunk, the high-voltage signal enters the brachial plexus at the base of the neck. Bypassing local motor adjustments, this critical sensory overload blasts straight into the dorsal horn of the cervical spinal cord, preparing to relay the emergency directly to your conscious mind. Reaching the cerebral cortex, the signal detonates inside the primary somatosensory map. Because your hands occupy massive real estate on the cortical homunculus, this massive influx of high-frequency pain signals triggers an explosive, widespread cortical activation, flooding your entire consciousness with raw, unedited agony. Flanking the sides of every finger are the proper digital arteries. When the sharpener's helical blade slices into these lateral pathways, it severs high-pressure arterial vessels. Oxygenated blood surges out under significant systemic pressure, filling the conical sharpener chamber with a rapid pool of fluid. Simultaneously, thousands of microscopic capillary beds are destroyed across the lacerated wound bed. Normally, surrounding tissue swells to compress broken microvessels. However, trapped inside the unyielding metal funnel of the sharpener, external pressure prevents natural compression, causing blood to flow continuously from open vessel ends. In response to physical trauma, local blood vessels undergo an immediate, protective spasm, constricting tightly to limit blood loss. But within seconds, local metabolic alarms trigger massive reactive hyperemia, forcing the smooth muscle walls to dilate wide open and flooding the damaged tissue with warm arterial blood. Damaged cells immediately spill a potent chemical cocktail known as the inflammatory soup. High concentrations of bradykinin, prostaglandins, and substance P saturate the lacerated tissue. This chemical storm drastically lowers the activation threshold of surrounding intact nerve endings, making the entire fingertip agonizingly hypersensitive to any touch. As the initial sharp shock from the A-delta fibers stabilizes, a secondary pain pathway activates. Unmyelinated C fibers, which conduct signals at a sluggish 2 miles per hour, begin firing continuously. This slow, chemical-driven signal converts the razor-sharp cut into a deep, agonizing, rhythmic throb matching your pulse. At the microscale, cortical bone is a dense composite of collagen and hydroxyapatite mineral crystals. While the hardened steel blade easily slices soft flesh, this rigid mineral matrix resists deep blade penetration, causing extreme friction that grinds microshards of metal and bone together under high mechanical force. The blade's rotational movement strips away the periosteum, the vascular, hyper-innervated membrane sheath covering the bone. Stripping this outer layer ruptures microscopic blood vessels inside the Hemorrhage canals, causing intraosseous bleeding and triggering bone pain receptors that signal deep, structural skeletal damage straight to the central nervous system. Near the base of the distal phalanx lies the insertion point of the flexor digitorum profundus tendon. If the rotating blade nicks this dense fibrous cable while the finger flexes in panic, extreme muscle tension can cause the tendon fibers to fray or avulse directly from the bone. As the steel cutter spins continuously against unyielding bone, rotational friction generates intense localized heat. Surface temperatures rapidly surpass 55 degrees Celsius, causing thermal protein denaturation in surrounding living cells. This adds localized thermal tissue necrosis to an already severe mechanical slicing injury. This mechanical event represents a complete multi-system biological failure. In under a second, a device designed for Shear delivers skin cleavage, nerve transection, arterial hemorrhage, and periosteal abrasion, demonstrating how easily industrial cutting geometry can obliterate delicate human anatomical structures when mechanical boundaries fail. Yanking your finger backward out of the tapering cone only increases mechanical shear, tearing more tissue against the spiral blades. Safely disengaging requires reversing the rotational crank. Counter-rotation backs the helical cutting edges away from the bone, allowing the trapped, lacerated tissue to disengage without secondary avulsion. So when operating rotary cutters, remember, steel blades make no distinction between cellulose and human tissue. It is blade geometry, mechanical torque, and shear stress operating at peak physics. Subscribe to Biomechanics Studio for surgical-grade biomechanical breakdowns.